Okay, this video is conventional medicine credibility for chronic disease. And, the typical scenario is a person is pretty healthy in their 20s, and then they get to their 30s, and there's a lot of things going on. They get married, they have a baby, they're working longer hours, they're up late with the baby. To compensate, they start drinking more and more coffee, eating more and more fast food out of convenience and a shortage of time. They're stressed out, and they get fat and sick. Okay, initially they're just fat, but then they start drifting into fatty liver, pre-diabetic, diabetic, hypertensive. Maybe the wood's not working so well for the gentleman. For the lady, she's fat, she's losing her looks. Lots of women lose their looks in their late 30s. The stupidest thing is if they smoke cigarettes, they can lose their looks in their early 30s. But a woman who eats low-fat vegan, she can keep her good looks for a long, long, long time, into her 70s. All right, so anyways, this comes from Dante. He says, in middle age, I found myself in a dark wood and the path was lost. Yeah, the person's sick and they don't know what to do. Okay, so I got an overall credibility meter here for the healthcare system. It's not so great. I'd call it maybe, but for some stuff. So, for acute disease, the emergency room could save your life. They are pretty good at a lot of things. For end-stage kidneys, they can put you on dialysis, keep you alive longer. And so, they're pretty good for some things. For a lot of other things, they're not so good. So for their overall rating of conventional medicine overall, I put it in maybe for some stuff. On a good day, so-so. Okay. Now, when it comes to chronic disease, though, you go to conventional medicine, and it might as well be, Dante here with Virgil at the gates of hell, where the sign says, abandon hope, all ye who enter. For chronic disease, conventional medicine, quite frankly, is incredibly ignorant and stupid. It stinks, okay? They tell you up front, we will never cure you. The cure rate for chronic disease is 0. That's why it's called chronic disease. 0 cure rate. For hypertension, for diabetes, for atherosclerosis, coronary artery disease, they never cure the patient. The patient takes pills or has surgeries and takes pills for the rest of their life. Okay. Now, so I say for the credibility rating for chronic disease in conventional medicine is less than 0. They always never cure the patient. I would also say the credibility rating of keto, paleo, low-carb, carnivore diet is also less than 0 because they make the patient sicker. They don't tell the patient about the true option that could be done to cure them, and the patient just gets sicker and sicker. The pills don't work so well, they fail, the patient has irreversible complications and goes on to worse and worse problems and, quite often surgery. And this is for numerous chronic diseases. For arthritis, they end up getting joint replacements. Okay, the next thing is, you got coronary artery disease. If you go low-fat, low-sodium vegan diet, you can cure it for nothing, for free. You got to pay for food anyways. You go to a regular doctor, they're going to put you on a stress test. There's going to be some stenosis quite commonly. They might stent it, then they can't stent the rest of it, send you for open heart surgery. Each stent bill's about $30,000. Open heart, about $150,000 all told, from the surgery and pre and post-op care, and you end up with what I call the 5 wounds of the village idiot. Cardiac cath, wound in the groin, chest tube, mediastinal tube in the chest tube, sternotomy, a right IJ Swan for the Swan-Ganz catheter for measuring pulmonary artery pressure. So that's what conventional medicine will do. It'll chop you up even if you don't need it. And then let's say, what about for religion? Oh, religion makes people a lot healthier. Just start reading about it. You'd be amazed how much healthier religious people are. All the longest lived zones, they tend to be quite religious. Okay, but that's religion, and it's not perfect. It's got problems too, but overall it's very good. Now, let's look at vegan diet. I would put vegan diet overall credibility at very good, but the vegan diet has problems, and vegan diet alone is not the same as low-fat, low-sodium vegan. A person could be a vegan and eat just junk food. They could eat French fries, they could eat, potato chips, all these fried foods. I think fried foods are the main reason why a lot of people from India have a relatively high incidence of diabetes and coronary artery disease, even if they're, almost vegan except for the ghee butter, okay? But yeah, eating fried foods are terrible. Oils are terrible for blood flow, terrible for atherosclerosis, increased leaky gut, increased cancer. There's a lot of flavorants in processed foods, monosodium and in manufactured free glutamate. The salt itself gets you to eat more. This MSG, MFG stuff gets you to eat more. When it's not organic, it could be sprayed with who knows what, atrazine, glyphosate, all this junk. And this other stuff in here, AP, and then, these two letters here, and then an L. Okay, that, you don't want that stuff either. So that's all bad. All right, so then the next question is, well, what about low-fat, low-sodium vegan? Even that's not perfect. It's got problems in the sense that you still got to watch out. You can have MSG, MFG in organic food. You can have this AP, then double E's, then L. You can have that on organic food as well. So you still got to be careful to watch out for that stuff. Even if you're eating what I consider the best diet in the world, low-fat, low-sodium, low-protein, 100% vegan, 100% whole food, 100% organic, with no SOFAs, alcohol, or MJ. And, this is pretty much the same diet that's agreed upon by, Dr. John McDougall, by Veg Source Jeff Nelson, by Chef AJ, and by other experts in the nutrition community. So anyways, it's great, but it's not perfect. So you still want to keep learning how to avoid these things. But it's as good as you're going to do. I can tell you, out of everything in medicine, and I've been a doctor over 30 years, and I've been studying nutrition in some detail for over 20 years, that's the best you could do, and it's the most powerful thing in all of health because it's the species-specific diet. So it's well worth your time to know it. It's your best chance to age well.